Colon cancer is cancer that starts in the colon, also called the large intestine. It is one of the most common cancers in the United States. Recent studies show it is rapidly increasing among people under 50 in the U.S. You might also hear the term colorectal cancer. This term includes not just colon cancers, but also cancers that form in the rectum. The rectum is the last part of the colon where waste leaves the body. The colon is a major part of your body's digestive system. This large tube-like organ has four parts: ascending, up, transverse, across, descending, down, sigmoid, bottom. Cancer can start in any of the four parts. Your colon absorbs water and nutrients from food that has gone through the stomach and small intestine. After the colon does its job, it stores the waste that is left over. This waste stays in the colon until you have a bowel movement, poop. Over time, you can develop small growths on the tissue that lines the colon or rectum. These growths are called polyps. Almost all colon cancers come from polyps. But that does not mean all polyps will turn into cancer. Actually, most polyps are benign, which means that they are not cancer, and most polyps will not turn into cancer. However, since we don't know which polyps will turn into cancer, we remove all of them. Most polyps do not cause symptoms, even when they are large. You might not even have symptoms if you have early colon cancer. Many people have no symptoms until the cancer is advanced. These symptoms can include bleeding, constipation, weight loss, abdominal pain. These symptoms do not mean you have cancer, but you should ask your doctor about them. By now, you may be a bit concerned about colon and rectal cancer. The good news is, you can do things that may help prevent it. Even more important, colon cancer is very treatable when found early. Things that may lower your risk for colorectal cancer include eating a high-fiber, healthy diet, getting moderate exercise, avoiding smoking and alcohol. While these steps are not proven to prevent colon cancer, they may help, and you will be healthier overall. You can help prevent colon cancer by knowing your risk factors and getting tested. There are several different tests, including ones you can do at home. Talk to your doctor about the best age to start testing and what type is best for you. Regular screening can find polyps and remove them before they turn into cancer. Detect colon cancer before it becomes advanced. Advanced colon cancer is much harder to treat than early cancer. 9 out of 10 people whose colon cancer is diagnosed early survive it, so getting screened is very important for your health. There are many ways to screen for colon cancer. One of the most common is a test called a colonoscopy. In this test, your doctor uses a thin, flexible tube to check for polyps or early cancer. For most people, age 50 is the right time to start colon cancer screening. If you have a higher risk for colon cancer, you may need to start sooner. Just like other cancers, colon cancer has different stages. It is much easier to treat in the early stages. Stage 0, abnormal cells in the lining of the colon. These cells cannot spread to the rest of the body. Removal by colonoscopy is usually enough. Stage 1. Cancer has invaded the wall of the colon. Your doctor might still be able to remove this cancer during a colonoscopy. Stages 2 through 4 usually require surgery and chemotherapy because cancer may have spread outside the colon to other parts of the body. Metastatic colon cancer. Cancer that has spread from the colon to the rest of the body. It may go to the liver, bones, lungs, brain, or other areas. This stage is much harder to treat, although researchers are making some progress. Treatment for colon cancer surgery is the main treatment for colon cancer. Depending on your individual health, cancer stage, and other factors, you may have chemotherapy and radiation. Your doctor will talk with you about the stage of your colon cancer and the treatment options.
Imagine a silent killer quietly growing in your gut until it's too late. That's colon cancer. It's one of the most common cancers worldwide, but here's some good news. It's also one of the most preventable types. Despite its preventable nature, colon cancer often starts with no symptoms, making early detection crucial. In this video, we'll explore the symptoms and warning signs that could save your life. Let's get started. One of the earliest signs of colon cancer is abdominal pain and cramping. While many conditions can cause these symptoms, the pain related to colon cancer often has specific characteristics. It might feel like a constant ache or cramp in your stomach area, with varying intensity from mild to severe. This discomfort typically occurs as the tumor grows and begins to block or narrow the intestine. Such blockages cause a backup of stool and gas, resulting in discomfort and pain. Sometimes, this pain is accompanied by bloating or a sensation of fullness, even after eating small amounts. Although abdominal pain can also result from gas, indigestion, or constipation, persistent or severe pain should not be ignored, especially if combined with other symptoms like changes in bowel habits or unexplained weight loss. If this sounds familiar, it's time to consult a doctor. Early detection through diagnostic tools like CT scans or a colonoscopy can significantly improve treatment outcomes. Seeing blood in your stool can be alarming. It might appear bright red covering the stool or mixed with it. Sometimes it's dark and sticky, indicating bleeding higher up in the digestive system. However, bleeding from colon cancer can also be invisible to the naked eye and only detectable through tests. It's important to note that not all colon cancers cause bleeding, and the absence of blood doesn't rule out cancer. If you see blood in your stool or on toilet paper, talk to your doctor immediately. They may perform a colonoscopy to investigate the source of the bleeding and recommend appropriate treatment. Ignoring this symptom could delay diagnosis, potentially worsening the condition. Unexplained weight loss, a significant drop in body weight without any intentional changes to diet or exercise, is another red flag. While weight loss might seem like a positive outcome, it can signal an underlying health issue, including colon cancer. Colon cancer-related weight loss often occurs as the tumor grows, interfering with your digestive system. The cancerous growth might impair your body's ability to absorb nutrients, leading to weight loss. Additionally, your body may break down muscle tissue and fat stores for energy, contributing further to weight loss. If you lose more than 5% of your body weight in a few months without trying, consult a doctor. While other conditions like thyroid disorders, diabetes, or depression can also cause weight loss, it's crucial to rule out colon cancer through proper diagnostic tests. Colon cancer can cause persistent fatigue and weakness as the disease progresses. These symptoms occur for several reasons. Internal bleeding from a tumor can lead to anemia, a condition where your body lacks sufficient red blood cells to carry oxygen to tissues and organs. The body's immune response to cancer cells consumes significant energy, leaving you feeling drained. The emotional and psychological toll of dealing with cancer also contributes to fatigue. If fatigue and weakness interfere with daily activities and don't improve with rest, don't ignore them. These symptoms could point to anemia or another underlying condition requiring medical attention. In many cases, colon cancer leads to chronic blood loss, which over time can cause iron deficiency anemia. This condition occurs when your body lacks enough iron to produce healthy red blood cells. Symptoms of anemia include fatigue and weakness, pale or yellowish skin, shortness of breath, dizziness or lightheadedness, and cold hands and feet. Anemia from colon cancer may develop slowly, making it easy to overlook. If you experience these symptoms, your doctor can confirm anemia through blood tests and investigate the root cause, possibly recommending a colonoscopy to check for tumors or polyps. A persistent change in bowel habits lasting more than a few days is another warning sign. Look out for increased frequency of bowel movements, persistent constipation, and narrow or ribbon-like stools. While these changes might have other causes, such as diet or medication, they could also indicate colon cancer. If you notice these symptoms, especially alongside abdominal pain or weight loss, seek medical advice promptly. Early detection makes treatment far more effective. As colon cancer progresses, a growing tumor can obstruct the normal flow of digestive contents, leading to bowel obstruction. This blockage causes food, fluids, and gas to build up in the intestines, resulting in nausea and vomiting. In some cases, treatments like chemotherapy may also trigger gastrointestinal side effects. Persistent nausea and vomiting, particularly if combined with other symptoms of colon cancer, should not be ignored. Diagnostic tests, including imaging studies or endoscopy, can help identify the root cause. Finally, persistent rectal bleeding is a significant symptom that warrants immediate attention. Blood may appear bright red, indicating bleeding in the lower digestive tract, or darker, suggesting an issue higher up. While rectal bleeding can result from less serious conditions like hemorrhoids or anal fissures, it can also indicate colon cancer. If bleeding is consistent or occurs with other symptoms such as changes in bowel habits or abdominal pain, consult a healthcare provider immediately.